Opioid death not only here in the Valley, but across the country. It started here in Fargo with more than $500,000 in federal funding. Valley News Team's Kellen Harmon shows us how these funds are being used to save lives.
The fight against the opioid epidemic has gotten a heavy investment after the ONE program, an opioid naloxone education program started at NDSU, received $632,000 from the North Dakota Department of Health and Human Services. There are two big measures in place, from preventative to life-saving. For preventative, they work with local pharmacies to supply a risk screening program where pharmacists and patients work together to determine if patients should be prescribed a lower dosage opiate or an opiate-free alternative.
We've had individuals, because of that conversation, say, you know, you are so right, and I'm so glad you brought this up because I've been wanting to change this.
Another big effort is supplying naloxone emergency treatment kits, which contain the nasal medication, medical equipment, and an instructional video so that anybody with no knowledge can potentially save somebody's life.
As you aim the tip towards the ear, you will push the plunger firmly.
As with the funding, it'll help the organization broaden efforts by doubling their reach for screenings as well as saturate the state with these emergency kits, which cost about $150 each.
Since July, we've doubled the number of interventions done per day because we've taken on all the pharmacies in the Thrifty White network. We've doubled the scale of the project.
Anytime we can expand a program like this, it benefits everybody. It makes people more aware of what they're taking. It makes our job as pharmacists easier because as we're counseling, they've already kind of looked at this list to see, oh, these could be potential problems.
For program leaders and those who work with them, they're thankful for not only the investment in their work, but the people in need of help.
Anything we can do to try and give them an opportunity to recover is worth doing. And anything we can do to help keep someone from succumbing to an overdose is worth doing.
In Fargo, Kellen Harmon, Valley News Live.
The hope is to have the emergency kits across the state in public areas from schools to bus stops. He added that ONE program helps more than 800 patients a month throughout North Dakota.